It's my pleasure to introduce you to my rockstar colleague, Christine Levens. Christine is going to take us into the next part of our program.
Great, thanks for that, Sherry. Hello, everyone. I'm so excited to see you all. I hope you had a really meaningful conversation in your small group conversation. Just a couple of housekeeping items. We do have this set up as a meeting today, so please mind your audio. And if you need to get up and stretch and get that glass of water, we encourage it, but be mindful of the status of your camera. We would not be together today without the support of Vault Health, who has been a sponsor of the Msp Wellness program, sponsored by the Chamber for over a year. Without them, we would not be here together. We'd like to get this meeting started, which we have a lot in store today, but we'd like to get started with a welcome video presented by our sponsors in the Chamber, Minneapolis Health Department, and Hennepin County.
Welcome, everyone. Thank you for joining us from across the region and the state. I'm Jonathan Weinhagen, President and CEO of the Minneapolis Regional Chamber. I wish that I could be there with you live today. I had the honor of joining Governor Tim Walz and business leaders on a mission trip to London and the UK to advance the interests of the state of Minnesota this past week. We know that successful partnerships bring together expertise, resources, and energy from multiple organizations and stakeholders to solve problems, launch big ideas, make meaningful and impactful change. That's never been more true than over the course of the last 20 months of the pandemic, as we've seen these partnerships not only form, but deepen and grow across multiple sectors and within organizations. For-profit and nonprofit partners have come together to support our public health needs, ensuring that the resources and direct services are available to those in communities that continue to be disproportionately impacted by COVID-19. Employers and employees have collaboratively taken on unique and oftentimes complicated challenges that have resulted from the disruption of our day-to-day work and home lives. By creating programs that provide easier access to health resources and support well-being and mental health, and work to keep one another connected. The Minneapolis Regional Chamber is proud to partner with Hennepin County Public Health and the Minneapolis Health Department as we help employers understand the business case for investing in the development of wellness programs. The value it brings to the workplace, the positive impacts it can have on the shared culture of an organization, and the overall well-being of their employee population. Together, we will continue to promote, support, and celebrate the successes of our worksite partners.
Hi everyone, I'm Kelly Hargis with Hennepin County Health at Work. We are proud of this partnership with the Minneapolis Regional Chamber and Minneapolis Health Department because we know it will improve our collective ability to better serve you. Those of you who are already familiar with Health at Work know that we offer affordable and accessible wellness programs and resources. This new collaboration will allow us to reach even more employers with ideas, tools, and trainings to help advance worksite wellness in Hennepin County. We welcome this opportunity to share our learnings and be able to better support the important work that you all do.
Hello, everyone. I'm so excited to celebrate the successes, both small and large, that we've all experienced in navigating the new challenges presented by the pandemic. Your hard work, perseverance, and sense of togetherness has brought love and light to our community this year. The Minneapolis Health Department is proud to partner with the Minneapolis Regional Chamber and Hennepin County Public Health to support the development and implementation of sustainable policies and innovative strategies that can help to support health and well-being across all sectors. To achieve our mission of creating systems that support health equity where we live, work, and play, we'll need to have strong partnerships like this one. Through this integrated approach, we can each bring fresh perspectives that drive meaningful strategies when serving businesses working on wellness initiatives and those who want to start. By working together, we can reduce duplicity, remove barriers, increase available resources for worksite wellness, and bring the best ideas to fruition by continuously improving programming to meet the needs of businesses and organizations. We strive to enable a shared learning space where we can all take action to do better together. Thanks for joining us.
Well, everyone, I hope hope you are as excited as I am about this great new partnership. And I want to take a moment to appreciate the folks that have been working on this event, moving up to this day, and through our conversation about the designation criteria that you're going to learn more about at the end of the program. It's been an exceptional journey, and there's much more to come. So it's my pleasure now to introduce our guest speaker today. Her name is Heidi, and she's going to get started with us. She is benefit manager for Blue Cross Blue Shield. So please help me welcome Heidi Kent-Mack.
Hi, thanks, Christine. I really appreciate it. Let me work on sharing my screen. So let me know when everyone can see that.
We sure can.
Awesome. So thank you again for having me here today. I'll introduce just a little bit about myself. So I am Heidi Kent-Mack, the benefits manager at Blue Cross and Blue Shield of Minnesota. On a personal level, I'm a mother to a sassy-year-old 4-year-old boy. I also married my high school sweetheart of 11 years, John Paul. And for fun, I love being outdoors, hiking, camping, going snowshoeing. I love crafting and reading and doing yoga. One of the things that I love so much about wellness is how I feel like a person's wellness journey is ongoing. What inspires you one day may be very different from the next, and that there's so many pillars to wellness that really help holistically frame up either a program or an experience. So in the last 19 months, I think everybody has experienced COVID, and some of the things that have taken a precedent when talking about wellness have been emotional well-being and then also financial wellness. So from an emotional wellness standpoint, ensuring that employees have the right tools to combat stress management and take care of their mental health. And from a financial wellness perspective, taking care of associates and understanding what it may be like if they have loved ones who have lost a job. I've brought wellness to work starting in early in my career when I was working in a healthcare company, and they were really working on building a wellness program from the ground up. We didn't have much of a budget, and a lot of the resources that we used were people volunteering their time. At that program, we actually utilized this book. Oh no, I don't know if you'll be able to see it. It's called, we can post it. It's called Wellbeing, and it's by Tom Rath and Jim Harder. They really focus on 5 pillars of wellness. So they look at social, community, career, financial, and physical well-being. And so we really utilize this book to start building out this framework to a wellness program that we could help implement across our organization. And, you know, from a career aspect, one of the things that we did was offer a mentoring program. And it was as easy as giving employees the opportunity to meet with somebody in a different department, or if they were going to school, meet with somebody in that area that they were going to school for, just either to sit and look at a day in the life or be able to ask questions and really understand more of what that person was contributing. Another thing that we did that was really easy was looking at social well-being. And we did a word of the year event where people thought through what was going to be their word of the year, similar to like a New Year's resolution. And we had a crafting event where we got everybody together and they were able to decorate a board or a sheet of paper with their word on it. And then they hung it in their cubicles. So it was a reminder to the passion that they were looking at bringing forward for the year. And it gave people a really good excuse to get together and just interact. I then left that healthcare organization and went to work in manufacturing. And there we had a wellness program, but we really reached out to our employees to say, what would benefit you? What are you looking at? What would be supportive to you in this wellness space? And what we had heard was financial. People really wanted to understand financial well-being. And so what we did is we partnered with our retirement administrator and had them come out on site around our manufacturing shifts to give just a simple presentation on what financial wellness was, the best ways to implement a budget, tools that are available to them through the financial advisor and their programs that employees could go and take home and watch with a partner or a spouse. And we got really good feedback on that. You know, a lot of the feedback we got was that those conversations had never happened for them before. And building a personal budget and having that chance to interact with somebody one-on-one was really beneficial to them. As I mentioned, I work at Blue Cross Blue Shield of Minnesota, and our wellness program focuses on 3 pillars. We look at financial, physical, and emotional wellness. We communicate our wellness programs through a monthly wellness article, and we do offer employees opportunities to earn money on events tied to one of those 3 pillars. Another thing that Blue Cross Blue Shield is really passionate about is racial health equity. And we want to be compassionate and understand what are the barriers affecting our community when it comes to healthcare, when it comes to wellness. And we have 9 strategic pillars. Racial health equity is one of them. And what we want to do is we want to take that a step back and say, what barriers could our employees be experiencing? And so we had a project take place around social determinants of health. I'll talk a little bit more about that here shortly, but that was something that really kind of drove some of our wellness initiatives in understanding what barriers our employees were facing, specifically in COVID, being virtual, but then more longer term. So those are some things that I'm passionate about when it comes to wellness and some of my experience. I'd love to talk more about how tools I've used to implement wellness programs in my past that have been successful. And so I'll touch first on benchmarking your practices, making sure that you understand what programs you offer and what are beneficial to your employees or where you have opportunities, I think is the very first step in really, talking about what you want to do going forward. Or if you're starting from the ground up, seeing what other local companies or organizations in your industry are doing. So you can do that by participating in like a benefits survey or a wellness survey where you can compare local organizations or other companies in your industry. The other really great resource is just asking your employees. As I mentioned, when I worked at the manufacturing organization, I reached out to our employees and I asked them, what are the benefits that you value? What are our wellness programs that you value? But then where are some space that we could really provide more support or more education? We did that during annual enrollment. And so we already had their attention. We did let them know that this would provide future direction, but it wasn't necessarily something that would happen tomorrow. And that's where we really started hearing more about this financial wellness piece. We gave them an outlet to share their feedback. If you have employee resource groups, that's another great resource you can tap into to see where there might be barriers or opportunities. And then it's also helpful that once you have that feedback, as you look at bringing that to your stakeholders to help with getting approval to implement things, you have more detail around the why you're wanting to make that change. The other thing, talking about implement a new program, it's important to start with something that's going to tie back to your company's culture and values. For instance, if you're an organization that says that you're family oriented, looking at wellness programs that can support new parent benefits, parental leave, caregiver leave, those types of things really help kind of tie that all together. And not only does it support your current employees, but as you have new talent looking at coming in, it really helps provide an ingrained feel to what your organization is and how they're supporting their own values and core initiatives. Especially in tying to that, younger employees coming into the workforce are expecting that companies are building out wellness programs. So as much as you can tie back to that, the better you're kind of bringing those new people in with a good feel. Another thing is to look at the resources that you might have available. So it's exciting to think about wellness initiatives and you can get really carried away, but it's important to take a step back and make sure you have what you need to have a successful launch. So whether you have a group of employees that are willing to volunteer their time to make sure that they'll take things on and help implement something, or whether you need vendor support, it's great to have those things up front and understand what's going to be needed. And then having that information available as well helps you kind of start to prioritize which initiatives you're looking at moving forward. And then it's always important to have stakeholder buy-in. And so each organization has a unique process when it comes to getting that buy-in. So ensuring you have the right influential people involved can help ensure that program's success. And then also knowing your objectives to the wellness initiative, what the cost is going to be, timing, and how to measure that success are a great way to start to get that buy-in and move forward. Communication is really important. So ensuring that you're building that excitement around a wellness initiative is key. If you're looking at doing this during, say, an annual enrollment, you can a lot of times tie that initiative into your benefit communication. You already have your employees' attention. However, if it's something you're implementing mid-year, you may need a couple more tools to try to kind of engage that excitement amongst the people you're reaching out to. And again, it's always important to tie that back to either employee feedback or the market data that you received. And then how are you going to communicate that out is really important as well. If you have to partner with a marketing team, making sure that you have their engagement and their time commitment in it, or if it's something that you can just simply send out on a monthly basis, those are things to kind of keep in mind as you're looking at building out that excitement in the program. And then measuring success, something we all need to do. I usually look at utilization. So is the program being utilized? Are we seeing enrollment? And then offering surveys to employees who are utilizing the program and making sure that it's actually meeting the needs that you are looking for and not causing any additional barriers. It also gives you a chance to reroute if something's not working as you would expect it to, or if you want to add on to the program. If you're looking at doing something and offering it from a pilot standpoint, doing a post-initiative survey is also really helpful in providing guidance of whether you want to continue it down the road or whether it's something you want to focus on somewhere else. Now, these are things that I've used that have been really helpful in implementing wellness programs, but I know it's not a one-size-fits-all. Not every organization is going to have these, and every organization is going to have the same support structure. And so it's going to look different everywhere, but touching on these pieces have been really helpful for me in making sure that I have the right players in place to get an initiative started. And so now I'm going to touch base on the Social Determinants of Health project that I had mentioned earlier. So as I stated, at Blue Cross Blue Shield of Minnesota, we have been focused on racial health equity, and we're really looking at that as it impacts our employees. So before COVID, we had started a survey with our employees by using a third party to keep it very confidential to understand how many of our employees were experiencing a social determinant of health. That ended up getting paused once COVID happened, but then last fall we were able to re-implement the program and just gather additional feedback from our employees. So some of the things that we had heard from them was that they needed support with caregiving, finances, food insecurity, career pathing, and then healthcare support. Upon getting this feedback, we got an internal group of people together to start brainstorming ideas of how we could really take that feedback, how we could implement something new, and how we could leverage some of the tools that we already had to help either share more guidance, provide more education around what was already available to them, or like I said, implement something new. So when we talked about caregiving, a lot of the things that we were hearing was that employees didn't want just support with young children, children who weren't in school yet. They were looking for support for school-age children. They were looking for support in caring for aging loved ones. And so earlier this year, we implemented a partnership with Care.com. And it's been something that's been really successful because it does encompass an overall support to all of our associates. So if you're somebody who is really busy and you need help just running errands, there's support there for that, along with support for tutoring or, like I mentioned, the aging loved one. We also offer a parental leave and a caregiver leave. And so we've built in ways to remind associates, specifically if they're going on like a leave of absence, that those are available to them if they need to take advantage of it. When we talked about finances, employees mentioned that they wanted more of an understanding of how to manage their budgets, support in how they're receiving their income. So what we did is we presented a financial wellness month where employees earned money for participating in a numerous events. They could take a webinar, they could have a one-on-one session with a financial planner, and then we also offered budgeting resources. We're also looking at our policies and our pay practices to see if there's opportunities there to help support our employees longer term. When our employees mentioned food security, we offer a giving garden at Blue Cross Blue Shield. However, with most people being hybrid or virtual, that wasn't really available. So we looked at offering a food delivery pilot for them, and that's something we're just implementing now to see what the engagement is like in that. With career pathing, we really wanted to start by looking at our job descriptions to make sure we didn't have any unintentional bias in what we were posting for roles that were open. Was the experience required actually necessary? The years of service, was that truly what was needed, or are we building some unintended bias in that? And then for healthcare support, a lot of this we heard from people who didn't live right in the metro. We do have a northern Minnesota office, and so if somebody in that office needed to go see a specialist, there was a significant time commitment in them seeking that care. So we're looking at ways to support with scheduling, and we're also looking to see if there's any sort of navigation assistance that we could provide to our employees that they could call in and have someone schedule those appointments for them, have someone see if there's a virtual option to really kind of build out this holistic level of care, that they're not stuck kind of trying to manage all that on their own. So those were some of the things we had brainstormed and had come up with to help support based on our employees' asks. We then brought those to our leadership team to see what should we prioritize, because Rome wasn't built in a day. And although wellness is super exciting, there's some things that you just have to take piecemeal by piecemeal, and you want to make sure that you're giving the right effort into each program. So we got our initiatives approved, we moved forward, and we started to build out those communication plans and making sure that we could tie things back to what our employees were saying so that they felt that their voices were heard. And then we're also measuring that success, like I mentioned, with care.com, looking at enrollment and getting our associates feedback on how they're feeling those programs are working. So I know I've gone a little bit over on my time, but I wanted to leave some space for questions. I also have my email here along with my LinkedIn website. I don't know, because I love talking about wellness. So if you would like to connect and just start brainstorming ideas or talk a little bit more, know that I'm more than happy to do that.
Thank you, Heidi. It looks like we do have a couple questions that I'm happy to share and to see if we can have some answers. Let's see, there's one question here that came from one of the earlier groups in conversation about supporting mental health well-being during the transition back to the office.
Yes. So one of the things that we're doing is we're doing a hybrid approach for most of our employees. So we have that where we're trying not to ask people to be in the office more than 2 days a week. We also this year bumped up our employee assistance visits for mental health. So instead of offering three free visits, we now offer 5. And with people coming back to the office, we're going to start having those posters out more. So as people are coming in, they're seeing it versus just having it on our internal employee website.
Thank you. Let's see. Here's another question. In addition to process outcomes like utilization, do you measure other outcomes, clinical or otherwise?
Yeah, that's a great question. So one of the ones that we've actually seen is around mental health. And so we have seen, and I'm sure other organizations are as well, but they're seeing an increase in mental health costs and claims. Now, on one hand, seeing that is concerning because you want your employees to be healthy, but on the other hand, you have to think about it from the standpoint of they're seeking care. So that's ultimately what you want to leverage, is making sure that your employees are finding ways to be well.
Thank you. And I think we have one more, time for one more here. Someone from the group has asked if they could hear a little more about the food delivery pilot.
Yes, we're super excited about this. So we actually partnered with HelloFresh. We broke down our employees by, we tier our medical premiums. And so for our associates who are more hourly or entry-level roles, they have a different medical premium. So for that group of people, we implemented this pilot where there's a subsidy for up to 250 employees to sign up for HelloFresh. And so HelloFresh is sending them weekly boxes for up to a month. And then we will survey them to see how is this going? Is it meeting their needs? Is it becoming a little bit more of a hassle to pick their meals each week? And so that just started, and we're really excited to see what kind of feedback we get. But like I mentioned, we offered it to 250 people, and we got a really quick sign up to that. We're subsidizing the boxes at 50%. And then for all of our other associates who didn't qualify, or for those that wanted to participate, but we had already had utilization, we do use a discount vendor that also partners with HelloFresh. So then we emphasize that you could still get the discount using HelloFresh through that vendor.
Heidi, that's fantastic. Thank you so much for sharing your journey, your insights, some of these best practices and creative ideas. We really appreciate you joining us today. And as mentioned to the group, we'll send Heidi's contact information, some links, and a recording of our conversation here. So Heidi, thanks so much. Appreciate it.
Thank you so much.
So let's see a little bit more about some of the really creative things that were done by the cohorts in Minneapolis and Hennepin County over the last 2 years. So let's go take a look at that video. There's some really exciting things that have happened.
Work sites around the region have started, implemented, and expanded wellness initiatives with funds from the Minnesota Department of Health's statewide Health Improvement Partnership, or SHIP, which serves as a powerful catalyst for creating healthier communities. In 2020 and 2021, over 40 work sites participated in the Shipmates program and Msp Wellness cohorts, focusing on different dimensions as they formed, launched, and evaluated their successes. Campaigns, planned activities, and team challenges focused on healthy eating and drinking, physical activity, and workplace and home office configurations. Social connection was a dominant theme in 2021, as worksites focused on ways to keep employees engaged with one another in a remote and hybrid work environment. Mental well-being was central to nearly all participating worksites. Flexible work schedules were implemented, communication blackout periods adopted, and employees were provided resources to reduce stress. Technology platforms such as Teams were used to share wellness tips, daily meditations, and staff challenges. More groups celebrated the wins and focused on the small successes of individuals, teams, and the organizations. Congratulations to all of the 2020 and 2021 workplaces.
Congratulations, indeed. That was so much fun to see. So many of us are living at home, and seeing the pictures of kids and pets just rings true a little more this year than ever before. We've been learning a lot so far today, seeing some great examples, hearing about some implementation strategies. I do hope that you are learning some things and your interest continues to be piqued. We put together a video with three work sites that have done 2 years of Worksite Wellness implementation plans through SHIP and the Hennepin County Partnership. We'd like to show a video that highlights some of the strategies they engaged to do their work.
So when I started the wellness committee, I initially just sent an email out to all the staff and said, here's a new initiative that we're going to be supporting at REACH is employee wellness. And if you have an interest in this area, reach out to me. We come together to create a plan for the year and then communication plans for various programs. Employee evaluation is a really important part of your wellness program. So we do an annual employee survey, which asks them basically what programs they've participated in, what they enjoyed about those programs, what could be better about those programs. The important thing about the evaluation is that you take the insight that you learn from people and actually implement it. So don't just ask people what they think and then not do anything about it. So if you hear feedback about how something's been going or good ideas that other people have about what could motivate them or get them engaged, please see if you can implement those changes.
The mission of BDH is really to help people, and we do that through designs. We really wanted to bring that mission into our own office and create an initiative that promoted just overall well-being for our own employees. We thought it'd be really cool to have fresh, organic, locally grown produce delivered to the office. We had a recipe share going where we would share the different recipes that we made with our food. So it was a really engaging way for us to all interact with each other and, not only enjoy this food with our families at home, really kind of spread the love.
Actually, our company's logo is Create a Better Store. So really what this program is, it's an additive to the culture and the well-being of our company and how we want our workplace to be. Extremely supportive of what Shipmates was able to supply to us. Of course, there's the financial backing, but more importantly, just the resources, the things that were online, the community, and just they're highly available to get the information and resources we needed to implement both of these programs. And I feel lucky that we were able to do it both years. The first year we really focused on health and wellness as far as physical health and wellness, and it gave us some really great ways to increase exercise, stress reduction type of activities within our company the first year. And then the second year, this past year, we focused a little more on mental well-being and mental health, especially coming out of the pandemic and the changes from COVID, from a completely remote work to being in office. It was just a perfect time to address issues around mental well-being and how we were going to reinvent our workplace and do it successfully and do it together and have some fun doing it.
I want to thank Jessica, Emily, and Benjamin for sharing their stories with us. I enjoyed talking with them so much. We were only able to highlight just a fraction of the work that they've done and the conversations we've had that I could see right on my screen. They have done a lot of internal work, and congratulations to all of them. Right now, I am really excited to announce something else very new. You have heard a lot about kind of cooperation between the Chamber, Hennepin County, and City of Minneapolis, and we are really proud to announce today that we have a new project that we're going to do together that is going to celebrate the work that all of your work sites are doing. We have created, in combination of past work and future work, a program called the Msp Wellness Champions. This is a program where your business can be acknowledged for all of the hard work that you've been doing. We've heard about foundational elements, we've heard about leadership engagement, we've heard about surveying employees, bringing wellness committees together, and doing work that really supports your employees and improves your work site. Well, you can be recognized by registering as an Msp Wellness Champion. We have a survey/application that will only take about 7 minutes to complete. We ask you a variety of questions that are all assigned points, and if you meet that threshold, you can be recognized as an Msp Wellness Champion. This is a no-cost program. We really want to expand it amongst counties and across the state so business can be recognized for the good work that we're doing. So we're going to send you a link to that. If this is kind of our first announcement of the program, so we really want to hear about what you think. So we'll ask you about that after the program. But we're hoping that folks will use this as an opportunity to promote their work, to use it as a retention tool and an opportunity to be recognized. We will be hosting collaboratively in 2022 a recognition event. So we will take a look at some of those work sites that are doing exceptional things and bring that to light and to everyone's attention. So I encourage you to take a look at mspwellness.com and take a look at that Msp Wellness Champions program. So with that, I would like to wrap up this particular portion. If you are able to stay and want to talk to others in your group, we are going to allow for that. So you can join and get into another small group, talk about what you've heard today, what was an interesting strategy, any sort of enthusiasm you have, or what you're going to bring back to your work site. So with that, I am going to turn it over to my colleagues who will be managing the small groups. Thank you all so much, and thank you to my partners.
Okay, well, as Christine mentioned, we do have an opportunity